Good afternoon, everybody, or good evening. I'm really excited that you all could join me today to talk about the thyroid. I am an endocrinologist, and I wanted to give you guys a little bit of background as to what got me interested into the field of endocrinology, and specifically the thyroid. And that's because I personally went through some thyroid issues when I was 16. I had a total thyroidectomy. And so learning about the thyroid, how it works, how it's affecting other parts of the body, what the medication involves, that all kind of got me interested in the field. And so that's really a big part of my passion that I wanted to share with you all today. Before we start, I just want to let everybody know I have no conflict of interest. This is all just coming from my research, what the current research is, and going off of my own personal experiences in treating patients. To start off with, we're going to go over the anatomy of the thyroid gland itself. So the thyroid gland is this butterfly-shaped gland that sits inside of our neck, and it sits right on top of our trachea or our windpipe, and then right behind the trachea is the esophagus. The thyroid is made up of a bunch of cells that contain colloid, and I'm going to discuss why that comes into play on the next slide. Now, behind the thyroid are these four little glands. I don't know if you guys can see my pointer, but these four little glands here, and these are called the parathyroid glands. Those are responsible for secreting calcium, but sometimes whether there is a mass on those can affect the thyroid gland, and vice versa. If there is part of the thyroid gland that's removed, that can affect the parathyroid glands. They are two separate entities, and today we will be focusing mainly on the thyroid, but just to clear up in case any of you have spoken to your physicians about the parathyroid glands, just to let you know where that's located and why there is a little bit of confusion with the name. Now, where the thyroid is located is very important is because if there's any inflammation itself of the thyroid gland, if you have any inflammation or if you have any nodules, it can affect some of those structures that are located within the neck. For example, there's because the thyroid gland itself is sitting on your trachea and can push into your esophagus, if you have any inflammation of the gland, if you have large nodules that are putting pressure in any of those areas, it can cause some difficulty swallowing because it's like you have something that's kind of pressing on your neck when you're trying to swallow. Or if there's some inflammation and there's a large gland, when you're laying down, it can cause a little bit of choking sensation. So just something to keep in mind in terms of your symptoms if you know that you do have a thyroid nodule or you've been told that you have a goiter and large thyroid gland. Those are the symptoms that we tend to look for. The other thing that we tend to look for is if there's any hoarseness of the voice. And that's because the nerves that supply the vocal cord run right behind the thyroid and cross underneath here. And so again, if there's any enlargement of the thyroid gland or if there are any nodules that could be pressing on it, that's another symptom that we look for. Now, the thyroid hormone itself is produced within the thyroid gland in these individual cells. The way that this works is your body takes iodine. Now, the thyroid is the only gland in the body and the only cells in the body that are going to use the iodine. And what ends up happening is the iodine is taken in by the cells and transported to the colloid. The colloid is where the thyroid hormone is made and then transported out of the cell. And so the colloid is where a majority of the work is going to be done. And this is the part that tends to become most affected if there is any sort of inflammation or any antibody activity by the thyroid and by the antibodies onto the thyroid. And that's why we focus so much on this colloid when we talk about the thyroid gland. Not sure why it's not moving. There we go. Okay. So the pituitary-thyroid axis. So this is I'm going to spend some time talking about this because this is most important when it comes to the thyroid function and how your body monitors and maintains thyroid function. We're going to start here with the thyroid gland itself. The thyroid gland produces two hormones, T4 and T3. Now it produces about 90% T4 and 10% T3. And this is because the body wants to produce more storage than active. T4 is the storage version and T3 is the active version. The reason that it only produces about 10% of the active version is because the T3, the active version, is really only active in the body or present in the body for about 5 minutes. And so we want to make sure that we have enough of the storage version present that gets converted to the active version as our body needs it. Now, based on T4, our storage, it sends a message to our hypothalamus, which will then send a message to our pituitary. The pituitary, it also sends a message to the pituitary at the same time. The pituitary is responsible for secreting a hormone called TSH. That stands for thyroid stimulating hormone. And the thyroid stimulating hormone does exactly that. It stimulates thyroid hormone production by the thyroid gland itself. When there is not enough storage or T4 present, then the pituitary will secrete more TSH. If there is too much, then the pituitary will secrete less TSH because it does not need to stimulate more hormone production. And so that's why we tend to look at both the TSH and the free T4, because we want to know exactly how much hormone is available within the body, but we also want to know whether that is sufficient enough for the body. And so we do need both. Now, your symptoms generally tend to come from the active version, how much T3 is available. So I personally like to check the T3 as well, but the T3 is constantly in flux. When you do your labs, you don't know whether you're checking it when it's already been converted, before there's been a conversion from T4 to T3, or somewhere in the middle of that conversion. Now, obviously, if it's significantly off in either direction, you know that there is a change that you need to make either by increase or decreasing supplementation. But generally, I go based on symptoms, whether or not your T3 is active or whether or not we need to supplement the medication to give you more active hormone that your body just might not be converting from storage fast enough for your needs. The other aspect of this, which unfortunately is missing from this diagram, is antibodies. What these antibodies do is they attack the thyroid gland, causing inflammation. This inflammation, depending on the hormone or depending how your body's reacting to the antibodies, can present either as an increase in thyroid hormone production or a decrease in thyroid hormone production based on specific inflammation of that colloid portion of the thyroid cell, which we saw on the last slide. And not only is that causing increased inflammation within the thyroid gland, but it also can cause increased inflammation throughout the body. So the inflammation throughout the body, it can be a vice versa relationship. Either increased inflammation throughout the body can result in increased antibody activity, and increased antibody activity results in increased inflammation of the body. And all of that can also affect the symptoms that you're having. Now, when we talk about thyroid disorders specifically, there are multiple things that can be going on. Now we're looking at specifically thyroid pathology, but another thyroid disorder that could occur is thyroid nodules. Generally, this can just be localized inflammation by antibody activity, or it could be overgrowth of thyroid tissue that occurs on its own. But that is another thyroid disorder that is present. Now, when we talk about thyroid function disorders, we're specifically talking about the overproduction of thyroid hormone. So when we talk about hypothyroidism, that is what we consider to be abnormally low activity of the thyroid gland producing less thyroid hormone. When we talk about hyperthyroidism or thyrotoxicosis, that is excessive thyroid hormone production, specifically within increased hormone production and increased conversion of the storage to the active version of the hormone. Then we have two separate autoimmune conditions. There is Graves' disease, which is the autoimmune condition from antibody activity and inflammation that stimulates excessive thyroid hormone production by the cells, or Hashimoto's thyroiditis, which is an autoimmune condition resulting in inflammation of the colloid and suppression of thyroid hormone activity. Those aren't necessarily, you don't necessarily have to have strictly hypothyroidism with Hashimoto's or hyperthyroidism with Hashimoto's, sometimes that antibody activity can cause either an initial hypothyroid phase before the hyperthyroidism in Graves' disease, or an initial hyperthyroid phase, and then decreased thyroid hormone production in Hashimoto's disease. And that just depends on how those cells are reacting to the inflammation. But generally, Hashimoto's will result in the underactivity, and Graves' disease will result in the increased activity of the cells and thyroid hormone production. Now, if you do have one of these autoimmune conditions, if your body most likely, if it has one autoimmune condition, is likely to have another. And the autoimmune conditions that tend to be most commonly associated with Graves' disease and Hashimoto's thyroiditis are celiacs, rheumatoid arthritis, and type 1 diabetes. So those are ones, if we know that you do have celiacs, type 1 diabetes, or rheumatoid arthritis, we generally like to look at the thyroid antibodies as well to see if there is possibility of developing a thyroid issue in the future, and vice versa. Now, celiacs is the one that's most commonly associated, and so that's one that we tend to check on the most. But rheumatoid and type 1 are the second and third most common. Now, what does the thyroid hormone do in the body? And I'm going to spend a lot of time talking about this in terms of both what the effects of excessive thyroid hormone and effects of underproduction of thyroid hormone have on the body. So number one is metabolic rate. It controls the metabolic rate of every cell in the body. And we're talking about body systems and individual cells and individual organ systems as well. So in a hyperthyroid state, it's going to increase your metabolism, and that's why we generally see rapid weight loss in a hyperthyroid state. But it also increases the metabolic rate within the cells of the heart too, producing increased stress on the heart. It can also produce high metabolic rate and turnover of cells within the gut as well. And that's why sometimes we tend to see diarrhea in patients that have a hyperactive thyroid state. In an underactive thyroid state, it will decrease the metabolic rate and therefore also decrease, it can cause weight gain. It'll same thing, have the same effect of decreased effect on the heart. And so we will see decreased cardiac function and also decreased metabolic rate of the gut. And so sometimes we tend to see swelling of the gut in patients that have significant hypothyroidism. Now, the rest of the effects on thyroid hormone pathophysiology all kind of stem from this metabolic rate of the individual cells. So the next topic I wanted to discuss was bone mineralization and bone turnover. So the body does require thyroid hormone in order to help build the bones when we're young. In our youth, there is a receptor, it's called osteocalcinin. And osteocalcinin is required in order for us to build our bones while we're growing. Without sufficient thyroid hormone, we're unable to reach peak bone mass and peak bone mineralization, which is why that's important. But thyroid hormone also stimulates osteoclastic behavior or osteoclastic cells, which are the cells responsible for bone turnover. That's why in a hyperthyroid state, we are very concerned about the development of osteoporosis because that increased level of thyroid hormone does promote increased bone turnover. The second the third issue that I want to talk about was heart rate and cardiac output, which we discussed a little bit when we were discussing metabolic rate. So during a hyperthyroid state, you will have high cardiac output because of the cells having increased metabolic rate and the cells increasing the heart rate and the cardiac output. Now, this increased cardiac output normally doesn't have too much of an issue, but in extreme states of hyperthyroidism, that can actually lead to heart failure and it can actually put so much stress on the heart. It can cause irregular heart rhythms and it may lead to heart attacks, which is why we get very concerned in patients that have excessively high thyroid hormone output and are in severe hyperthyroid states. Just like our bodies can't survive or we can't function at 250% for a very long amount of time or greater than 100% for long periods of time, neither can the body, neither can the thyroid, neither can the heart. And so that's when we start to look at decompensation. And that's where the cardiac output comes into play. So that's why we get concerned about leaving a hyperthyroid state untreated for long periods of time. Coincidentally, same thing in severe hypothyroid states or hypothyroid or just regular hypothyroid states is it can decrease that cardiac output, decrease that heart rate, and can affect the way that the rest of your body is receiving adequate blood flow. Body temperature is the next thing. Again, that kind of stems to that metabolic rate. When you're in a hypothyroid state, you can have a low resting body temperature, and in a hyperthyroid state, you will have a higher resting body temperature that can sometimes be confused with fever. LDL and triglyceride clearing. So why this is important is LDL, which is the bad cholesterol, and triglycerides are the two components of cholesterol which are responsible for plaque formation within our arteries. Now, thyroid hormone is one of the factors responsible for clearing those two types of cholesterol from our bloodstream. And so when your thyroid hormone is low and you're in a hypothyroid state, you're unable to adequately clear LDL and triglyceride, and which is why you might have an elevated cholesterol level, specifically these two. Generally, we will just watch and we'll see how the LDL and the triglyceride level change once you are back within we call it a euthyroid state, which is a normal thyroid state before treating. But if it is severe enough to where it is at risk of causing plaque formation in the arteries or causing blockages, at that time we will treat. But it is something to keep in mind if you are hypothyroid, that depending on whether or not your thyroid hormone is within a normal limit, if we supplemented enough, it could be affecting your cholesterol levels. The other thing that thyroid hormone is responsible for helping with and producing is red blood cell production. And so you will see a decrease in red blood cell production and associated anemias with hypothyroidism, and an increase in red blood cell production, and may even cause polycythemia within severe hyperthyroidism as well. Vascular cell relaxation and resistance. So thyroid hormone is responsible and does help with vascular cell relaxation and increased resistance. And so when that comes into play is when it comes to blood pressure. Now, when your thyroid hormone is significantly elevated, it will increase vascular resistance, which can then result in an increase in blood pressure. And so that's another reason why we want to make sure that we're keeping that thyroid hormone within a normal range. And again, we don't leave hyperthyroidism untreated for long periods of time. If with the vascular cells are too relaxed, it again impedes the blood flow getting to the necessary organs. And the last thing is nerve function. So the thyroid hormone, again, will help to propagate nerve signals through our nerves, specifically through the smaller nerves that are important for reaching our extremities, specifically our hands and our feet. So in severe hypothyroid states, severe hypothyroid states, you can actually present with symptoms similar to neuropathy, where you can get numbness and tingling in your hands and feet. It can even result in tremors and sometimes muscle weakness as well. So this one little hormone does a lot of different things in the body. Now, when we're talking about treating hypothyroid states, we generally want to supplement thyroid hormone. There are 3 different types of medications on the market which we use to supplement thyroid hormone. Number 1 is levothyroxine, and that is a talc-based medication, which is 100% T4, or that storage version of the hormone. Now, generally, what I've seen patients on is generic levothyroxine, because that's generally what insurance companies prefer. Some people are unable to tolerate generic and need branded. Now, the reason why branded is generally more important than generic is because, well, number one, of the quality of the additives that they're using. But the other issue is that every company that makes a thyroid hormone supplement is allowed a small difference within the amount of thyroid hormone that is in the medication. And that goes for any medication. If it's a branded medication, the FDA allows about a 10% difference. And if it's a generic, the FDA allows a 25% difference. Now, when you're talking milligrams, that's not that big of a deal. 10%, 25% is still within one dose. But when you're talking micrograms, like we are with the thyroid, 25% difference could mean a 3 to 4 dose difference in what you're receiving. The other thing is that the only thing that is similar between every company that makes a levothyroxine or a thyroid hormone supplement is that it contains thyroid hormone. All the additives are going to be different, and the additives are what determine how much of that you're absorbing. So it is important to ensure that you're getting it from the same manufacturer every single time. And the best way to do that is by getting branded medication. Now, if you are getting generic and it does look like you're getting the pill looks essentially the same every single time, whether that's in shape, marking, or size, then more than likely you are getting it from the same manufacturer. And we know that if a change is needed, it's because your body needs a change in thyroid hormone supplementation and not because you received it from a different manufacturer. The color scheme is going to be the same between all manufacturers of thyroid hormone supplementation, whether it's a generic or a branded version. But the shape, the size, the markings are what are going to be different. So that's what you're going to want to look out for. The other one is called Tirosint. Tirosint is a water-based thyroid hormone supplementation. Now, in some people that are unable to absorb levothyroxine or even the branded thyroid hormone supplements well, Tirosint is going to be the next best choice. It's going to have the same color scheme, but that's another option that's available. There are a couple of natural options available, NP thyroid and Armour thyroid. The difference between levothyroxine or the brands Tirosint and Armour thyroid and NP thyroid is that levothyroxine and Tirosint are 100% T4 and Armour thyroid and NP thyroid are a mix of T4 and T3, but it's hard to tell what you're getting in each pill. So these pills are essentially desiccated pig thyroid. And so each pill is can contain either 100% T4, 100% T3, any mix in between, or it could be nothing and just pure colloid. It's hard to know what you're getting. So that's why we recommend a levothyroxine or a Tirosint over the natural versions, because we know that you're getting a standardized amount every single time. Now, the other option is an addition of a pure T3, something called liothyronine. And like we were just discussing before, that generally is based off of your symptoms or if your T3 level is extremely low. And that might just be because your body's not converting T4 to T3 fast enough, but that is another option that's available to you. Now, specifically levothyroxine, and the brands need to be taken first thing in the morning on an empty stomach or at least 2 hours after you've eaten or drank anything at night. You want to make sure that you're waiting at least 30 minutes before eating, drinking, or taking other medications. If you're taking all your medications together, you're not fully absorbing the thyroid hormone. The other medications that can interfere with thyroid hormone absorption are iron, calcium, soy products, and that includes soy milk, antacids, PPIs, and H2 blockers. So that's going to be anything that you're taking for your stomach or stomach acid or acid reflux. These also can interfere with the absorption of the medication. So we recommend either taking them at night or waiting those 4 to 6 hours before taking them. So if you're taking it first in the morning when you get up, afternoon would be the earliest time to take these to make sure there's no interference. As far as hyperthyroidism, the medications that we do have available or treatments that we do have available for hyperthyroidism are medications that suppress the production and conversion of the thyroid hormone to the active state. These medications are methimazole and propylthiouracil or PTU. The other option that we do have that's available is radioactive iodine ablative therapy, which is where we give a labeled iodine And because the thyroid is the only gland or only cells in the body that use iodine, the thyroid is the only gland that's affected, and we basically are destroying the thyroid's ability to produce excessive hormone or produce hormone. So those are the treatments for hyperthyroidism. And then generally, it is a lot easier to supplement the hormone that would have been produced by the thyroid once we've destroyed the thyroid or decreased the thyroid's ability to produce hormone than it is to try to control excessive hormone production by the thyroid. Now, I've had a lot of patients ask me about supplements or ways that they can augment their thyroid hormone supplementation and their thyroid treatment. And so one of the biggest things, especially when it comes to autoimmune conditions, is to make sure we're decreasing overall inflammation of the body. So any supplement that is going to decrease your inflammation, specifically turmeric and ashwagandha, are going to be very good for helping with your thyroid or helping to augment your thyroid hormone supplementation. Selenium is another supplement that may help with the thyroid, because that is another supplement that can be used within the thyroid's ability to bring iodine into the cells. Now, theoretically, because your thyroid is using iodine to produce the hormone, giving your body more of that substrate, more of that iodine, should help your body produce more thyroid hormone. However, excessive amounts of iodine can have the opposite effect. Excessive amounts of iodine will either cause your body to take all of that up and produce hormone in spurts, and so you will go from producing a lot of hormone to nothing and then producing more again, and it'll keep going up and down, or it can produce just a straight hyperthyroid phase depending on how much iodine you're taking in. Or it can overwhelm the thyroid and cause the thyroid to go into shock and not produce hormone at all. We get plenty of iodine from our diets based on either the iodized salt that we put into our food or that's put into food that we buy, and in a lot of the vegetables that we eat as well. But if you are taking a supplement that does have iodine in it, make sure it doesn't have excessive amounts. You want to make sure that you're not getting anything more than 50% of your total daily requirement of iodine through your supplements. Kind of going back into medications that can disrupt or cause a detrimental effect on your thyroid. Some of the medications and supplements that may interfere, again, iodine is one that, again, can have that paradoxical effect of either overproducing or suppressing thyroid hormone production altogether. And so again, that's one to be careful of. The other two medications that I see a lot of that also can have a disrupting effect on the thyroid are lithium and amiodarone. And the reason for that is because both of these medications contain a large amount of iodine. And so again, it can cause one of those two effects. It's either going to cause overproduction of thyroid hormone in spurts or complete overproduction, or suppression and shock of the thyroid gland. And so these tend to occur more if there is an autoimmune condition present, if there are antibodies present, but just something to be aware of if you are on either of those medications. Now, the last supplement that I wanted to discuss is biotin. Biotin does not directly disrupt the thyroid hormone with either its production or effects in the body, but it does interfere with the labs. If you are taking biotin and in doses that are at least 300 micrograms or greater, it is going to interfere with the chemical that we use to check both the TSH and the free T4. So I recommend stopping it for a minimum of 2 days. A week is best, but minimum if you're unable to stop it for 2 days prior to getting your labs done to make sure that there's no interference. And that's going to be, biotin tends to be in our multivitamins. Generally, if it's in a multivitamin, it's less than 300 micrograms. But if you're taking any supplements specifically for hair, skin, and nails, or sometimes it's within a vitamin B complex, that's when we start to get higher doses. So just something to take a look at if you're taking any vitamin B complexes or specifically anything for hair, skin, nails. And then the last thing I wanted to discuss was diet. So there is some anecdotal evidence about foods that you should eat, foods that may interfere with thyroid hormone production, thyroid hormone absorption. However, there isn't true data showing that specific foods will directly improve your thyroid. However, there is data showing that certain foods will increase inflammation in your body, and those foods, if you avoid them or limit your intake of those foods, specifically if you do have an autoimmune thyroid condition, can decrease thyroid hormone production. So by decreasing your intake of foods that are pro-inflammatory, you can decrease antibody activity and help with your thyroid hormone production or help with your thyroid disorder. The foods that tend to be most pro-inflammatory are going to be salt and sugar, number one, and basically anything processed. The more the processed the food is, the more inflammatory it becomes. The other four that tend to be inflammatory are going to be dairy, red meat, soy, and gluten. Now, everyone's body is different. Everyone reacts to these foods a little bit differently. So what I would recommend is just kind of listening to your body and look at your symptoms. Generally, what I tell my patients is to do an elimination diet, eliminate these four specifically, dairy, red meat, soy, and gluten from your diet, and then slowly reintroduce them one by one. See how you feel with it. If you notice that by eating dairy, you feel worse, your symptoms get worse, you have more fatigue, then that's something that you want to limit or eliminate from your diet. But if you feel okay, it doesn't change the way you feel, then that's not something that is very inflammatory for your body, and it should be okay to eat in moderation, but okay to eat that won't affect your thyroid. And then the other foods that you want to make sure, especially if you have an autoimmune condition, that you're limiting are foods that are going to have large amounts of iodine. And that's going to be from shellfish, kelp, seaweed, sea moss, iodized salt, and red dye number 3. Now, they don't use red dye number 3 in a lot of foods anymore, but it is still used in maraschino cherries. But that's just something to keep in mind, that it can cause, again, one of those paradoxical effects if you do have an autoimmune condition. If you don't have antibodies present, then it's less likely for these foods to cause a lot of issues for you. So I just wanted to end by giving you guys my information, my email, and my office contact information. Thank you guys for joining me, and open to any questions.
I want to also share that I have everyone's email, so I will send Dr. Kinkhabwala's webpage to everyone where you can schedule an appointment online. And then we are also recording this, so we'll also share that on YouTube in case anybody has any questions. But Dr. Kinkhabwala, there was one question to the chat. What about muscle motility?
Yes. Yes, so muscle motility is also affected by thyroid hormone. And so because the muscles do require that metabolic rate, that metabolic factor in order to function, when the thyroid hormone is low in a hypothyroid state, you're more likely to get that muscle weakness. But the same thing in a hyperthyroid state, you can still get that muscle weakness and muscle fiber breakdown. And if you think about every other organ in the body, specifically, the heart and the gut, those are also affected in terms of muscle motility. So when you're in a severe hypothyroid state, that muscle motility is going to dramatically decrease. And so not only you're going to have a slowing down of your digestive tract, but you can also have that swelling of the digestive tract from that decreased muscle motility. And that's also why in a hyperthyroid state, it speeds it up and you do have that diarrhea that could occur.
Okay, the next question, does thyroid affect calcium metabolism?
So thyroid, the thyroid is less likely to affect calcium metabolism itself. It's more likely to affect bone turnover and bone breakdown, which may lead to increased calcium. So it's more the effect on the bone than it is the calcium metabolism. yes, it can sometimes have an effect.
All right, the next question was, is the radioactive pill effective with a high percentage?
It is, yes. So I don't know the exact percentage off the top of my head, but generally, most patients that are in a hyperthyroid state, I would say about 90% only require one treatment. There are about 10% of patients that will have a little bit of resistance to it and do require 2 treatments, but it is highly effective. We like to get a thyroid uptake and scan beforehand to see exactly how much of the iodine the thyroid is taking up, so we know how to dose it.
Okay, there was a comment, if someone was diagnosed for over 8 months before finding out the TSH readings were 72, can that have an effect on your metabolism?
Yes, it can. Yes, because having a high TSH, being in a hypothyroid state, will put you in, will affect your metabolism. So that in and of itself will cause your metabolism to be low. Now, that's not a long-term issue. Once we get your thyroid within that, we call it the euthyroid state, which is where we've brought the thyroid back to your normal body functioning, the metabolism will return to normal. But during that period before you were diagnosed where the TSH was elevated, during that period, you will have a decreased metabolism.
And last question, is magnesium a good supplement to take for the thyroid?
Yes, magnesium is also a good supplement to take.
Well, if no one else had any additional questions, okay. I want to thank everyone for taking time out of their day to join us. It was a very good presentation, and I will send out the method to make an appointment with Dr. Kinkhabwala, and I'll also notify you when it's on YouTube if you have any want to review.
Great. Thank you, everybody, for joining me today.
Thank you, everyone. Have a good evening.
Thank you.
You too. Thank you.